Hey guys, Dr. D, Healing Hands Chiropractic, and today I want to talk to you about the 5 benefits of chiropractic care during pregnancy. That's right, pregnant women do get adjusted. So the first and foremost reason of why is a pregnant woman want to get adjusted? Well, because they hurt. So we help to decrease pain. Now that can be pain from cramps, that can be pain from low back issues because the body now has extra weight on the front, so they have to shift back, the pelvis widens. There's all sorts of reasons as to why pain occurs during pregnancy. They're completely natural. But if your body doesn't have as much pain because it's working, it's in better alignment, then the pain during even just carrying the child of pregnancy or delivery is going to go way, way down. In fact, the research that's out there says anywhere between an 18 to 42% decrease in level of pain under regular chiropractic care during pregnancy. So that's number one. Who doesn't want less pain? Any pregnant woman doesn't want any more pain, especially their husbands. Their husbands put them in this position in the first place because they agreed that that's going to happen. So, but the husband's not going through the pain. So if he can help his wife feel better by maybe getting them adjusted, this is be a really good treat for you. I know it's Father's Day coming up soon, but it would also be a really nice treat for your wife. So low back pain going down, huge improvement. Number 2, it's better for the positioning. So what do I mean by that? Well, last time I checked, when's the last time you put your head as a battering ram that you used to fit through a 10-centimeter hole? Probably when you were born. So that being said, when you have a big force of trying to get a baby out, imagine the baby's head like a basketball. So got a nice round basketball, fits through a nice round hoop, right? Well, if the mama's pelvis is the hoop that it's supposed to fit out of, what happens if maybe the mom's been in a car accident, or maybe there's been an issue where she's played sports or an athlete, or maybe she has scoliosis? What'll happen is the pelvis will actually shift and rotate. Now try to fit a round basketball through a crooked hoop. A lot more challenging. So if the positioning of the pelvis is easier, what that means is baby can come through and deliver a lot easier. So positioning is number 2. Plus, here's the thing. If mama's pelvis is twisted sideways, maybe baby is lying transverse, or maybe baby's entirely breech. In fact, we do something called a Webster's technique, which is known at optimizing or helping to make sure mama's pelvis is nice and balanced so baby can slide through a lot easier. Webster's technique is done by what's called International Chiropractic Pediatric Association members, and I am certified in it. And we don't ever turn a breech baby, but we actually allow the body to fit together appropriately, and oftentimes babies will turn before they go into labor. So in fact, I have a 98% success rate at making sure that babies who maybe weren't in the right position got into a better position, and we did it all through just chiropractic adjustments and the Webster's technique. So it's definitely something we specialize in. Doulas and people like that send us a lot of clients, midwives do too, because they know that we can have a better position for mom and baby's pelvis to head ratio. It's a lot easier on the mama to carry the baby full term and to push it out. Speaking of push it out, that's number 3 reason. Less labor time. So again, the research that's out there shows that if everything works together, you can produce results faster. Anything in business that you look at is if you have a great system, the time it takes to get from point A to point B is a lot less complicated. Well, the same thing happens with birth. So if your body is working together, if your brain can communicate to the different muscles and it's balanced right and left, it's equal, that's not schizophrenic where one side is really contracted and doesn't know how to contract any further because it's all already there, and the other side's too loose and it's not getting the message from your brain that it needs to push hard. So it makes birth a lot more challenging, a lot more frantic, a lot harder on the mama. And then you'll find that at this point in time, mamas will stall out in labor. So then they have to, maybe go through a different route of treatment. So if everything works together, mom's brain is feeding babies the right things and feeding her own body the energy it needs to go through delivery, that's a lot easier. So delivery is a lot like a marathon. you got to work real hard to get from point A to point B. And if all your muscles are firing the right way, if your brain is telling you, hey, this is a positive thing and it's releasing the natural pain relievers like oxytocin, it's going to work a lot better. So all the research that's out there for the most part says that decrease in labor times by around a third. So especially the second and the third time around, most of my moms said, I don't even know how I got through my first pregnancy without you. I would never do another pregnancy without chiropractic care because my birth was just so much easier. It fits so much better. So number 4, why else would they get adjusted? Well, because it's a drug-free, if I can spell, approach. So that means that all the studies that are out there, they are not allowed to do drug testing on pregnant women. It's actually something that's known as like the Nuremberg Code, I think is what it's called. I'm not exactly sure, but basically the government has said it's not ethical to do drug tests on pregnant women because they don't know what's going to happen to the baby or to the fetus. So rather than say anything negative about the drug community, it's just they have their place, and I get it, and sometimes you don't want to feel birth, and I understand that, but if you want to have your body work better and not have a potential drug that you ingest go into your baby, then chiropractic is a drug-free approach that helps to naturally balance everything, helps to allow your body to function better, and you don't have to worry about anything as a potential drug interaction because, you know, your baby doesn't know anything about any of the drugs yet. They haven't been exposed to any of them, so we don't know if there's a negative effect or a positive effect on it. So rather than, like I said, talk negatively about it, it's just we avoid it in the first place, so you don't necessarily have to go down that road. Number 5 is we just want everything for the baby to have less stress. Pregnancy is stressful on both the mom and the baby. So as we were talking about during delivery, if the baby's head gets pulled on to get it out of the canal or out of the C-section, that's a lot of pressure on their delicate little spines. And they always say, protect the head. Don't let the child, have any sort of head wobbling that's going to cause damage, that's going to, potentially hurt their neck. But unfortunately, in the heat of the moment, birth, delivery, getting the kid out, there's a lot of pressure. So we check kids immediately after birth because if everything's straight, if everything's not crooked, basketball's going through, mom's in less pain, we're not having to use the drugs, baby still has to go through the stress of birth, and so we check the child after. So it's actually kind of a number 5 for the kid as far as getting adjusted because it does help them function better, it does help them feel better, and a lot of the benefits that parents will notice is their kids, will sleep better. They won't have as much colic, their reflux will go down, and those are things that we can check very shortly after birth. And what mom doesn't want their kid to be absolutely 100% perfect after they just work so hard to create this beautiful life and help them to come into this gorgeous earth of ours that we have. So these are 5 reasons. I'll give you a number 6 just as an extra bonus one, is it does help with hormone balancing. So a big issue that people don't really understand is pregnant women have a lot of hormones. And I mean a lot of hormones. Ask any pregnant woman or sister of a pregnant woman or mom, or we know, we get the idea. So number 6 of hormones, getting adjusted does help to balance those hormones, because when you're under stress, when your body's subluxated, when it's misaligned and it's not getting the communication, that's a stressful situation. It's like a traffic jam. So our job is to find those areas, calm that down, because if you have less stress hormones, your body actually has the ability to produce more feel-good hormones like endorphins and enkephalins, which are natural pain relievers, or oxytocin. Oxytocin is a huge hormone when it comes to pregnancy and women. So the more of that you produce, the better mom feels, the better the bonding experience goes, and the better that everybody creates that family bond and creates that beautiful experience. So as a chiropractor, I am pediatric certified. I am pregnancy certified in the regards that I've taken all of the ICPA classes. It's I'm Webster certified, and what we do is we help pregnant women have the birth of their choice. We educate you on your different options of birthing choices, be it doulas, be it midwives. We've got great people that we refer back and forth to. And another big thing that we look at is, well, if you are a pregnant woman, it's hard to lay on your tummy. So we've got these beautiful, amazing pillows that have this nice little hole in there that actually allows you to be able to lay on your tummy without any difficulties of feeling like you're crushing a baby. So we've got tables that also have breakaway pieces to where you can lay flat down on your tummy. And most of the time, all of my pregnant women say, do I really have to get up? I don't want to move. I feel so good laying here. So we have the pillows for the mamas and the tables for the mamas and the specialized techniques for the mamas too, to make sure that we can achieve all of these benefits of getting adjusted while you're pregnant. So if you know of a pregnant mama who has considered chiropractic care, we're not scary. We have a lot of fun. We see these women all day. We have a ton of kids, as you can see too, that after mama has become pregnant, she brings the kids in later on for their adjustments as well. So our office is very friendly. Mama Joni, our staff, is beautiful. She's called Mama Joni for a reason, because she just helps these kids feel at home and comfortable. And that's the number one thing that we hear from our moms who are pregnant and are bringing 2 or 3 kids along with them. Everybody's getting adjusted, everybody's getting checked, everybody's feeling great, and they say, I just feel like it's a family here. And that's what we want. We want you to become part of our family, and let us become part of yours by getting yourself checked out and see what we can do to help you feel and function better, mama. We love you. God bless. Talk to you later.